today's Mental Health Action Plan by Sinn Féin. So I'm delighted to be here, and thank you all for attending, and to be joined by my colleagues Mark Ward, who's our spokesperson on mental health, David Culnan and Deputy Sarah Clark as well, to launch this action plan for mental health. And this is a policy that has been put together by the party over a long period of time, something that Mark has spearheaded and championed. And we in Sinn Féin believe that when something is broken, you stop and you fix it. And the health service in Ireland is in a perpetual state of chaos and indeed crisis. For Sinn Féin, the long-term solution is clear. You need an Irish national health service, one that is truly public, that provides health care on the basis of need, not on who you are or where you live or how much money you earn. A system that is funded by progressive taxation. Fair, timely and free mental health care provision is a vital part of our vision of what a national health service would offer. And the plan that we're launching today is another step in unwrapping our vision for that health care and what it should look like and what it should be in the Ireland of today. Sinn Féin's Mental Health Action Plan would transform how we deliver mental health services right across this country. It sets out our absolute commitment to delivering widespread and significant change and a fresh start in mental health care. Our plan is based on fairness, it's based on access to high quality of local services, early intervention, prevention, suicide reduction and much more. We would also ensure parity of esteem between mental and physical health, and that mental health is seen as an all of government priority. The key difference between our plan in Sinn Féin and Fianna Fáil and Fine Gael's approach is that we will move away from decades of crisis management and underinvestment to a community-based proactive care approach. And this would be backed up by multi-annual funding, long-term planning and workforce planning. We would engage with the mental health sector, as we have done and we continue to do, and we've done that, as I said, over a long period of time now, led by Mark Ward. And we've engaged with that sector in Ireland, from the voluntary, the community services, to the HSE providers, to the researchers, to formulate this plan, to make sure that they fed into this plan. And Sinn Féin is serious about tackling the deficits created by successive government in mental health care. And this plan outlines in detail 20 specific measures that Sinn Féin would take in government. The government have paid lip service to the issues of mental health and well-being, and they've failed to deliver on their own promises of vision for change and sharing the vision. The result is for all to see in all of our communities, and there's very few households now that aren't touched by issues in terms of the failures in mental health. The result is that the mental health services in this state are in a state of emergency. Funding has been stagnant, reform has been stalled, and waiting lists have reached crisis point. And behind each and every one of those numbers is an individual, is a young person, is an adult that's reaching out for help, and many times that help is not there or is delayed. Investment in mental health and well-being is a no-brainer. The social and economic benefits of a healthy and happy society are numerous, and the impact on young people's development and our own growth as we age cannot be overstated. So I'm going to ask Mark, as I said, Mark is the engine behind this, who's been engaged with the sectors, to go through some of the key measures in our plan, and then I'll ask David to talk in relation to some of the measures in the plan. Maybe we'll focus on workforce, and Sorka then will come in relation to perinatal care. Thank you.
Thank you, and again, I just want to reiterate what Peter said. Thanks to everybody for coming today. And I said this is probably a accumulation of the last 4 or 5 years work since I became spokesperson for mental health for the party. As someone has worked in frontline addiction services and mental health services right across Dublin and outside of Dublin, I know the importance of people getting the right care in the right place at the right time. For too long, people have been falling through the cracks in mental health services. Sinn Féin's action plan that we are launching here today would transform how mental health services are delivered right across the country. We've had comprehensive engagement with stakeholders from the HSE to the community and voluntary sector to international experts. We've had Oregon from Australia, who are international experts in child and youth mental health, come over to us as well, and we had workshops with them. and we tapped into all of that knowledge. We also met, which was really, really important, people that had first-hand living experiences of mental health services, either directly themselves or family members who would have went through mental health services, and we listened to them and what issues that they had with the services. And all of this has influenced the policy that we're launching today. The very first piece that I'm going to go through a couple of the key kind of the key policy asks that we have in this document. So the very first piece of legislation that I introduced after I got elected and involved, it was early 2020, was the no wrong door bill for dual diagnosis. Now this was based on my own experiences of working in addiction and mental health services. If somebody has a dual diagnosis of mental health and an addiction, they often fall through the gaps. So they turn up at a mental health service, the mental health service will say, go off and deal with your addiction and then come back and we'll help you. Or they could turn up with an addiction service, which more likely the addiction service say, we haven't even got the funding to deal with you, we haven't got the training to deal with you. So people are falling through the gaps. So the very first thing that I've done was put in legislation for that. This document will enshrine this legislation. That means that people will get the right care in the right place at the right time. This bill will ensure that no matter what door that person knocks on, that they will be treated with the dignity that they deserve. One of the first things that we would do on the no wrong door policy would reopen Keltoy. Keltoy is a trauma-informed state-run facility treating addiction and mental health dual diagnosis. Keltoy was closed in March 2020 during COVID restrictions, and despite government promise, which Simon Harrison, when he's Minister for Health, said he was going to reopen it. Sinn Féin said he was going to reopen it as Minister for Drug Use and Addiction, and it hasn't happened. We're in 2024 and it still hasn't happened. There's a commitment, they said they're going to open it, but funding hasn't been released, and this is one of the first things that we would do in relation to the no wrong door. The next area I want to touch on is CAMHS, and you don't have to believe me when I say there is issues in CAMHS. You just have to listen to the Maskett report, the Mental Health Commission's report, and even there very recently we had Family for Reforms of CAMHS who launched their own report. And what this showed was highlighted a lot of problems that are in CAMHS in relation to governance issues, in relation of children being prescribed inappropriate medication, lack of follow-up, children falling off a cliff edge when they reach the age of 18, unacceptable waiting times for high-risk referrals, and many other operational issues. What Sinn Féin, the first thing that Sinn Féin would do, we would amend the Mental Health Act to regulate CAMHS. I introduced legislation back in March to do this. The government decided to put a time-bound amendment on it and kick it down the road for 9 months, which meant it'd be dealt with at December or just after that. But we can deal with this now. We need to regulate CAMHS. At the moment, the Mental Health Commission has the right to go in and do a report on CAMHS. They've made 49 recommendations, but they haven't got the statutory powers to make sure that these recommendations are implemented. That's one of the common sense things that we would do straight away. We've seen waiting lists for CAMHS spoiled under this government. There's been an 80% increase in the amount of young people who are waiting for a first-time appointment with CAMHS since this government came into place. Just in 2020, there was just over 2,000 children waiting for a first-time appointment. Now, this is a first-time appointment for a mental health service. Now that has risen to just under 4,000. We've also seen a 140% increase on young people who are waiting for a first-time appointment for over a year. So you imagine you have been deemed that you need an acute mental health service as a child, and then you are referred into a service, and you think as a parent that your child is going to get the care that they need. We have children, over 540 children who are languishing on the waiting list for over a year at the moment. That is just unacceptable and needs to be dealt with straight away. Children are absolutely being denied the right to reach their full potential. What Sinn Féin would do, we would increase the capacity in CAMHS so that no child would be left behind. Another initiative that we're looking to do in CAMHS is in relation to the child and youth mental health services. 75% of all mental health conditions are established by the age of 25. International research will tell us that. But young people between the ages of 18 and 25 are not specifically targeted for early intervention. Sinn Féin would address this by introducing a new child and youth mental health service that would eventually replace CAMHS. This would ensure that young people would stop falling off cliff edge at the age of 18 and ensure there was continuity of care. Primary care should be the first port of call for people who are experiencing periods of mental health difficulties, and the vast majority of mental health or psychosocial needs can be met through community and voluntary services. But it's vital that these children and these adults get the early intervention. Failure to get this could lead people to needing the more acute service like I just mentioned. Sinn Féin would deliver universal counselling in primary care. We ensure a consistent relationship between GPs, core community partners such as Jigsaw and secondary and acute care services. And we would prioritise and regulate psychology, counselling and psychotherapy. That's been going on since 2018 and hasn't got any closer to be regulated. We've seen the documentary on prime time that Barry O'Kelly had a couple of months ago that showed how dangerous it is in relation to having people unregulated working in this sector. The people that are the really good counsellors, psychotherapists and psychotherapists, they want to see their industry regulated because that safeguards them, but also safeguards the vulnerable people that they are dealing with. Another issue that we're looking to do is around crisis intervention and 24/7 access to emergency mental health care. So for too long we have seen the Gardaí being the gatekeepers for mental health. If you watch the documentary that's on Virgin Media at the moment, you'll see that if you talk to any Garda, I talk to guards in my community on a regular basis, and they will tell me that a lot of their issues when they're called to something is in relation to somebody that is having a traumatic experience in the community with their mental health, and the guards are called to deal with it. Mental health difficulties do not just occur between 9 and 5 or Monday to Friday, they can happen any time. There was a pilot project introduced in Belfast in 2019, and it was a really successful out of our crisis intervention team. What it was, you would have a mental health expert, you would have a paramedic, and you would have a member of the guards, or in the case of Belfast, the PSNI, who would go and meet that person that was in trauma in the community. They would meet them, they would triage them, they would treat them, they would refer them to the appropriate service, or if necessary, they would bring them to an appropriate service. This led to a reduction in the amount of calls that the guards were getting to deal with people in trauma in Belfast, but also led to a reduction in the amount of people that were attending the accident and emergency, the EDs up in Belfast as well, which took pressure off an already pressurised part of our healthcare. I've been pushing the government to introduce the same. They did come out with a commitment that they would introduce a pilot project in Limerick. That was 2 years ago now, and they still haven't introduced it, and I don't know how close it is. I've stuck in a number of parliamentary questions trying to see when this will happen. I've been given false dawns since this has happened. We would deliver this if you're in government and in this policy document, and we would also enhance the other existing emergencies out of our services that are already there. The last one I was going to speak about is the national clinical programmes. There has been little or no funding for the national clinical programmes for new developments in the last 2 years. And they include early intervention psychosis, suicide prevention, ADHD and eating disorders. And as we know, and it's been well documented, that eating disorders are the most fatal of all mental health conditions. However, there are only 3 public adult eating disorder beds in the whole state. 3 for the whole state, and you have to be in the catchment area of CHO area 6, where St. Vincent's is, in order to access them. So what's happening at the moment, the reality is, if a person has an eating disorder and they get to the stage where they're really feeling unwell in themselves, they may turn up to an accident and emergency. If they're lucky, they are referred into a generic psychiatric facility where they are not getting the specialist eating disorder help. While they're in there, their body mass index is increased to a safe level. They are then discharged from the psychiatric hospital back into the community, and then that cycle happens again. And it's an ongoing situation. I've met a number of people who have gone through that situation. I've talked to parents of young adults who have gone through that situation. We have meetings with body boys who are telling us this is a common occurrence. And the fact that we still only have 3 eating disorder beds in the whole country is an absolutely shame, given that the government said they were going to prioritise eating disorders when they came into power. We would fund 20 additional eating disorder beds that were laid out in sharing division, and we would also enhance the community services that are out there. So that's just a brief synopsis of some of the policy parts that we have in this document, and I hope to take questions at the end as well.
Mark.
Yeah.
David.
From August, you're all very welcome, and I just want to start by thanking Mark for the work that he has done in his office, and Mark and I have worked very closely on the issue of mental health over the course of the last 4 years, and I thank Piers for his support as well, because there is obviously a huge financial ask as well to deliver on all of the measures which we have this year. And mental health is a real priority for us in the overall healthcare system. We know only too well from our own constituency offices and our own work that mental health is a huge challenge for every age group, every age demographic, every social class, but particularly for young people. And the work that we did in terms of engaging with people who work in the sector at primary and community care level, people who work in the acute side in CAMS, we met with healthcare specialists, consultants. As Mark said, we met with international specialists from Australia who are leaders in this internationally, but also advocate groups. But most importantly, we met with parents and children with mental health episodes and difficulties and challenges, and also children themselves. So it's really important that we engage with those who work in the sector, and all of the proposals which we're proposing here are through the lens of all of those discussions and meetings we've had. So I just want to thank Mark for his work there as well. In one of the meetings we did, we had that group that Mark talked about that came over from Australia. We brought together healthcare professionals who work for the HSE as well in a one-day conference, and there was one PowerPoint presentation that was given a copy. There was a lady that was talking about psychosis, and she had up on the screen the picture of a car held up not by four wheels but by policy documents, and she was making the point that there's no shortage of vision, no shortage of policy documents. We have vision for change, sharing the vision, but lots of other documents as well. And it's really frustrating when you actually have good policy, and we as an opposition party have recognised and have commended when there is good vision and good policy published. But the frustration is it isn't delivered, the resources and the capacity isn't there, and there's no follow through. And that was the real learning point for me, that we can't just produce more plans, whether we're in government or whether we're in opposition. We have to produce plans that are credible, realistic, and also properly funded. So the key for me, and Mark has outlined this, is we need to make sure that people have access to mental health services when they need them. And it's not just anecdotal, you see it in all of the mental health reform reports that are published, that young people end up going into emergency departments to access mental health services. They're in the wrong place, they're told. They very often get returned home. It's very distressing for the families of those children, and it's all because we don't have the primary care and community care supports and services there, and as a last resort they end up then going to an emergency department, and their issues are not properly dealt with. So the lack of integration, the lack of services at primary and community care level, for me, is where the heavy lifting needs to be done. That's why most of the measures concentrate in those areas. And obviously then we want to reform CAMS. People will be aware of the crises we had in South Kerry as one example, in Cork as another example, where we don't have enough psychologists, we don't have enough psychiatrists, we don't have enough consultants working in those areas. And the workload that they had, and the number of young people presenting, just couldn't cope. There was a failure in standards, as we know, and that led to a number of reviews and reports. But all of that could have been prevented if we had proper planning. And that's the point that I want to emphasise here, that it's important for us to set out what we will do, but it's also important for us to set out how we will make it happen. And the first thing that we will do, if we were in government, is to set out a multi-annual plan for mental health. We will do it for national strategies and for other areas in healthcare as well. But for all the measures contained in this report, or this policy document, the total cost over the 5-year period is 250 million, most of that on the current side. There are some beds that we will fund separately that will impact on mental health, but we will outline those in our alternative budget and in our manifesto when that comes as well. But for the 20 key measures which are in this document and more, the total cost will be 250 million. We would set out on day one that certainty, that funding streams will be made available, because because what we're being told is the lack of certainty. You know, the whim of the minister every year, we see it over the last number of years as an announcement of additional funding, only for the sector and people who work in the HSE, in the healthcare as well, to find out that almost all of it are posted for what's called existing levels of service, just to stand still, and there's very little money for new measures. So our total package of measures of 250 million is for new measures. It's exclusive of any additional money that would have to be made available for ELS and for standing still and for pay and demographics and so on. So it's real additional money that we will put in to ensure that the vision that we're setting out here will actually be delivered, and that people get the wraparound supports where they need it and when they need it. And key to this is not just the multi-annual funding, it's workforce planning, because what's really frustrating for me and for Mark is anytime that we put in parliamentary questions or we raise issues with the Minister with responsibility, whether it's Mary Butler or whether it's Stephen Donnelly, they will say it's not about money, we can't recruit the staff. Well, they can't recruit the staff because they haven't trained them. They haven't trained enough. So we know we have a shortage of psychologists, for example, and yet we can see over the last 4 years that we've seen a 50% increase in young people waiting for access to primary care psychology. That's the case almost across all community waiting lists, and I published a response I got from the HSE on that a number of weeks ago. But in terms of child psychology at primary care level, that's just one good example of where we're being told, well, the money, we simply can't recruit them, and they can't recruit them because they're not trained enough. It's the same with the consultant psychiatrists. If we can't recruit them into the CAMS areas and what would be a new child or new mental health service that we would develop, then you will continue with the same challenges and problems. So workforce planning is really important, and what we've committed to in a very extensive document that I published this time last year on health is to establish a working group that will be headed up by Taoiseach, supported by the Minister for Health, the Minister for Higher Education and others, to actually get serious about workforce planning, to double training places, to deal with the issues that Mark talked about in terms of regulation on certain professions like psychotherapy and counselling as well, but actually to train more healthcare professionals and double that training capacity over a 5-year time period. But particularly focusing on those areas where we find it difficult to recruit. And that's the important part. We know that we have a crisis in recruitment in some areas. We also have had a recruitment embargo for the best part of the year, which obviously didn't help and had a devastating impact mainly on community services. The Minister says the recruitment embargo is over, and in reality it isn't. You could say that the total ban is over, but the staff ceiling that the HSE agreed of just over 2,200 staff, which is shared across all elements of healthcare, primary, community, acute, hospitals, all of that, is about 1/3 of what the HSE were recruiting each and every year for the last 3 years. So they have very limited ability to recruit. And I spoke to the chief officers in CHO areas across the state, and they're telling me that this is having a real impact. So on the one hand, there are professions where we can't recruit because we're not training enough, on the other hand, we can't recruit because the funding isn't there, and because the resources are not there. So for Sinn Féin, this is going to be a key priority for us. Mental health is something that impacts, I think, right across society. It hasn't got the attention it needs, it hasn't been given the priority it needs, but it certainly will if we get our chance in government. And as Mark said, we'll take questions as well from the Commission. Thank you.
Good morning, David and Nigel Sarka. We'll talk to us about one of the other measures in the plan.
Thanks, Pierce, and I want to thank Mark and Dave for his work to date around mental health, but also to Mark for bringing forward this action plan today. I am going to speak to measure 17 specifically that's contained in this plan, and it relates to the specialist perinatal mental health in-service model for women who need that level of care. At the moment, the current model of perinatal services is actually very, very good, and they are very well thought of, and they are very well resourced, and they deliver excellent service to the women who need it. However, there is one vital piece of that service missing, and that is the inpatient model. So back in 2017, this was highlighted and this was recommended, and we have yet to see any meaningful work made on that. So we still don't have a date for when that 10-bed unit in St Vincent's Hospital would open. And there is no justification of saying that we need to wait for the new National Maternity Hospital. We do not need to do that. So what's happening at the moment, and what Sinn Féin are committed to see stopping, is that mothers are separated from their children and they become inpatients of the acute mental health service. That, to our mind, is grossly wrong. It's something that needs to stop, and it's actually counter to what is considered the best standard of care for mothers, where a dedicated specialist perinatal mental health service would allow mother and baby to be together, so mum can receive the care that she needs, while also ensuring that that really special bonding time between mother and baby isn't interrupted. Because one of the consequences of that happening is that it can, at a later date, have another impact on mum's mental health, and that's not something that anyone wants to see. So what we are proposing is an investment of 1.7 million in current expenditure and a capital investment of 12 million to ensure that the specialist service is open for all the women of Ireland when it is that they need it. I also want to speak briefly about an issue that Mark mentioned around the Universal Council. A number of years ago, 2022, Sinn Féin launched our policy of women's voices in menopause, and we focused very much in that document on the mental health aspect of menopause, the anxiety, the depression that can affect some women. This Universal Counselling Service through primary care will be a tremendous resource to women the length and breadth of the country. We have some very good menopause hubs. Unfortunately, they're not located in every community. Primary care is located in every community. And we still have the situation where women, particularly in rural Ireland, are paying an exceptional level of money to go to a specialist service, when that service should be and could be provided in their own community. We know 1 in 10 women will experience menopausal symptoms for up to 10 years. That is a significant period of time. And we have a plan in place that will deal with these mental health issues that women going through perimenopause and menopause will experience. So again, I want to thank Mark for the work that he's done to this. I want to thank him for bringing it forward today. And also, I want to draw your attention to another document around the specialist perimental mental health service. And there's one in April, just gone. And it's from the Psychological Society of Ireland, Special Interest Group in Perinatal and Infant Mental Health, and also by the Irish Association of Infant Mental Health, who have issued their strong support for a unit like this for the women of Ireland, and have also highlighted how it would support and foster mental health of both parents and of children. This is an issue of priority. This is a system at the moment that isn't delivering for the women of Ireland, and it's one that we are committed